Thanks for tuning in to the BOAH YouTube channel for continuing education. Today we're going to talk about canine brucellosis and best practices for a complicated disease. My name is Dr. Melissa Justice, and I'm a field veterinarian with the Indiana State Board of Animal Health. In addition to my field duties, I'm also the Director of Small Animal Health Programs and the Director of Brucellosis Programs for all species. It's with full disclosure that I let you know that I am not an expert in the field of canine brucellosis, nor am I a veterinary pathologist. But over the past couple of years, I've had the opportunity to work with some amazing veterinarians here in Indiana and breeders, both hobby breeders and commercial breeders, to navigate this difficult disease and working towards elimination in those kennels, as well as helping breeders try to prevent this disease from getting into their kennels in the first place. Along the way, I've learned a lot of things that are considered to be best practices, and I'm hoping to share those with you today so that I can help you in the future as you're working through these difficult cases. We'll start by talking about what is canine brucellosis. Canine brucellosis is a highly contagious bacterial infection that predominantly affects dogs. Wild canids can also be affected, but they have to have the right conditions and the right exposures. And this is a zoonotic infection, so humans can be affected by the disease as well. This is an extremely difficult disease to eliminate once it's established in a population or kennel, so the best practice is prevention and not letting the disease get into the kennel in the first place. Unfortunately, testing can be difficult with questionable results that are difficult to interpret, and there's no known cure, so dogs that are infected are considered to be infected for life. And this has been highly debated over the last 10 to 20 years. There are some people that believe that antibiotics can effectively treat a dog and cure the infection. And what we know is that antibiotics can suppress the dog's bacteremia for 3 to 4 weeks after the last dose of antibiotic is given. And this can cause the dog to test negative, but we know that this is a false negative test result on our standard serologic screening tests. We don't believe that the antibiotic has the ability to effectively eliminate the bacteria from the reproductive tissues. So even though we're getting a negative test result on our standard screening test, that dog may still be capable of shedding that bacteria into the environment and affecting other animals. So as of right now, there's no known cure for this infection, and antibiotic treatment is not recommended. Elimination is defined as 2 whole kennel negative tests performed 30 to 60 days apart. So this is what's required for us to consider a kennel to be to have the disease eradicated or to have the disease eliminated from their facility. If we look at the number of investigations that have been conducted over the past 3 years, it would seem that the prevalence of disease is increasing in the state of Indiana. In 2019, the Board of Animal Health conducted 10 investigations into suspected canine brucellosis. That resulted in 8 positive diagnoses or confirmed diagnoses, compared to 3 investigations that were conducted in 2018 and 2 investigations conducted in 2017. However, I'm not convinced that we have a true increase in the prevalence of disease here in Indiana, rather an increase in awareness amongst our veterinarians and our breeding population. So we're seeing an increase in the number of tests that are being run, either in response to clinical signs or as a screening process, and then subsequently those positive tests are being reported to our agency and investigated. Something that may be causing a slight increase in the number of cases that we're seeing is the movement of dogs, either through the movement of breeding animals into Indiana as out-of-state kennels go out of business, or through the movement of rescue animals. And I want to talk just a little bit about this because I want this to be something that you're considering on your differential diagnosis list if you're seeing these animals. It is not uncommon for large kennels, as they're going out of business, to offer their breeding animals for sale either through an online auction or through a local auction. And this is a good opportunity for our breeders to diversify their genetics and to diversify the breeds that they're currently dealing with at a reduced cost compared to what they might be to just go out and seek those animals themselves. For instance, last year we had a large kennel go out of business in Missouri, And this was an opportunity for our breeders to go out there and purchase these animals and bring them home, again, at a much reduced rate. So we had a breeder go out and purchase some animals and bring them back into their facility. Now, unfortunately, those animals did not have a test at the time they were brought to that auction, so they had a veterinarian on site to perform that test. The dogs were brought back home to the facility here in Indiana, and it was about 4 to 5 days before the test results were reported back to them. Unfortunately, those test results were all positive, so those animals had to be euthanized. But this was an instance where we brought that disease back into the state of Indiana. Another topic that I feel like is important to address today is the movement of rescue animals, both within the United States and internationally. And we had 2 examples of this in the last couple of years that I want to provide to you. Last year, we had a group of rescue animals that were transported from the Southwest, where brucellosis in dogs is a much higher prevalence. Those animals were brought to Indiana to increase their opportunity for adoption and to help find them their forever homes. Unfortunately, one of those dogs was a young dog that was brought up to Indiana and was immediately adopted out. And because the dog was experiencing some symptoms of back pain and lameness, the owner elected to have the veterinarian work up that problem, and the dog was found to have discospondylitis secondary to brucellosis infection. And unfortunately, that owner was adamant that that dog not be euthanized, so they now face a long life of chronic problems with a dog that can't be cured. The other situation that I want to bring to your attention is dogs that were imported into Canada out of China. They were rescued from the meat trade, and they were brought into Canada, where they were then dispersed to several different rescues, both throughout Canada and the United States. 3 of those dogs found their way to Wisconsin, where they were tested for canine brucellosis and found to be positive. So the movement of rescue animals is an opportunity for us to introduce this infection into the state of Indiana. And I just want to make sure that you're aware of it and that you're keeping it on your list of differentials. I'd like to talk briefly about the impact of brucellosis on the humans that own these animals. We all think about the economic impact that this can have. Obviously, these dogs are usually involved in a breeding situation where the goal is for the owners to make money off of the sale of puppies, or at least to break even, because they're doing this as a hobby and they enjoy it. Unfortunately, the reproductive losses can have a huge economic impact on their breeding program through the loss of puppies, through puppies that are born and then either fail to thrive or are weak at birth, or through the lost breeding potential of their adult animals, through the medical or reproductive problems associated with female dogs, or the sterility in a stud dog. We also need to think about the fact that infected puppies can have a huge liability on a breeding program. So if a puppy is infected at the time that it's sold and then develops into a zoonotic infection in its new human owners, this can have a tremendous impact on the reputation of the breeder or the liability of them selling a zoonotic infection to a human. We know that it's difficult to eradicate once it's established, and it can involve expensive ongoing testing to reach elimination. I also want to touch briefly on the emotional impact that this can have on the owners that are affected. The impact on kennel owners can be tremendous because they're facing the repeated euthanasia of adult dogs, the potential euthanasia of puppies as they're selling those dogs and they're testing them. If one of them turns up to be positive, they're probably going to be faced with euthanasia of that animal, and that can be emotionally very devastating for them. As well as the economic impact can be emotionally devastating. A lot of our commercial breeders, this is their only source of income for their entire family. So if they are faced with tremendous costs associated with veterinary care and veterinary diagnostics, as well as the euthanasia of their adult dogs, this can be very devastating for them emotionally, and we need to keep that in mind. I think we're all aware of the emotional impact that this disease can have on pet or rescue animals, especially when the primary method of treatment is to recommend euthanasia of these animals. That can be very emotionally devastating for new owners or people who have recently rescued these animals. We also need to keep in mind with our service animals that this is a partner for a lot of our law enforcement officers, as well as a very, very important part of the lives of people who have disabilities that rely on these animals for their independence and their freedom. So keep the emotional impact in mind when you're dealing with these cases. Moving on to clinical signs. Clinical signs can show up as early as 2 to 3 weeks post-infection, all the way up to 6 months post-infection. But what is very important for us to remember is that these dogs may be completely asymptomatic. So it's not uncommon for someone to purchase a new animal and to bring them into their kennel and see no clinical signs whatsoever, and not be alerted to the presence of infection until other dogs in the kennel start showing signs of reproductive failure or abortion early on in the course of infection. Clinical signs that we need to be aware of are reproductive issues, ocular issues such as anterior uveitis, back pain and lameness, which can be attributed to discospondylitis, or lymphadenopathy. And this can be generalized lymphadenopathy or localized lymphadenopathy encompassing only 1 or 2 lymph nodes. Reproductive issues that we see in female dogs tend to be late-term abortion, usually at 45 to 60 days of gestation, with no other clinical signs whatsoever, and or infertility or failure to conceive. And it's not unreasonable for an owner to bring a dog into the clinic for you to evaluate, because she's always had a good reproductive history. She's had successful litters in the past, and now all of a sudden they can't get her bred back. So that's a common complaint that you may see that should make you be thinking about canine brucellosis. Conception is possible for infected female dogs, but those pregnancies tend to result in smaller litters, and they have a potential for weak or fading puppies. We also see retained placentas and endometritis in female dogs. Males tend to suffer from inflammation of the reproductive tissues, which can result in infertility. So we may see orchitis, prostatitis, or inflammation of the epididymis. And this inflammation may result in tender or swollen testicles early on in the course of infection. As that infection progresses and the inflammation resides, you may notice that those testicles have become shrunken. And it's not impossible for you to see 2 different sized testicles, as one is shrunken and or the other is normal size or swollen comparatively. These dogs also will often exhibit signs of loss of libido. A common misconception amongst our breeders and some of the veterinary professionals is that this disease is only transmitted through a breeding exposure, and that's not true. It's our job to keep our breeders aware of the fact that there are other methods of transmission outside of the course of breeding. Puppies can be exposed in utero or through nursing shortly after birth. Dogs can be exposed by contact with birthing fluids, after birth, or abortive tissues, and these tissues contain a high concentration of infective material. So if we allow other dogs to have contact with these fluids or tissues, they can be exposed and infected without ever having had a breeding contact. Vaginal secretions also contain a high level of infective material, especially around the time of estrus. Urine is another source of infection for other dogs, and this is something that I want to mention to you because it is not impossible in our commercial breeders for them to have these dogs on woven wire cages or tenderfoot so that the urine and the feces can drain out of the kennel into a drain system underneath the kennels. The breeders may come through 1 or 2 times a day and rinse those drains down, and what can happen is that urine can splash up into the cage of another animal who may have not had any direct contact with the infected animal, and they can be exposed by licking the urine that splashed up into their cage. So keep that in mind in some of our commercial breeding operations, that is definitely a risk. Semen also contains a high concentration of infective material. The highest concentration occurs 2 months post-infection, all the way up to 2 years or more post-infection. Mechanical vectors are probably a lower potential for infection, but it's something that I think that we should be discussing with our breeders. Brucellosis can be carried into a kennel through foot traffic between rooms or between kennels, on our unwashed hands, so it's important for us to remember to wash our hands between dogs and between litters of puppies, or to use hand sanitizer. Breeders should make this readily available for us when we're in visiting these kennels, to make sure that we've got good hygiene between dealing with different litters of animals or different kennels. Our clothing is possible to transmit this bacterial infection. One thing that I talked about with one of our breeders is that they were using coveralls to process the different breeding animals and the different litters of puppies, but they weren't aware of the fact that if they got vaginal fluids or secretions on their clothing, they really needed to change that clothing before they went on to the next group of animals. I'll also mention equipment. Kennels and crates are sometimes used temporarily to house animals while owners are cleaning kennels. And if those kennels or crates are not disinfected between groups of animals or litters of puppies, they could potentially transmit the infection that way. We also need to be aware of veterinary equipment and grooming equipment and make sure that we're cleaning and disinfecting those items between animals. If you take nothing home from this presentation today, I want you to think about discussing quarantine with your breeders in the future. This is one area where we have noticed that our breeders may be lacking or may be deficient, and I don't think we can stress this enough to them as a means of preventing the disease from getting into their kennel. All new breeding dogs, whether they're adult dogs or their puppies, need to be quarantined in individual cages until they can be tested, and we'd recommend that they be tested twice, at least 4 to 8 weeks apart. And the reason for this is that they may come into the facility with a negative test, but if that owner isn't sure that that animal wasn't on antibiotics prior to being tested, they can't have a lot of faith in that test. And so we would recommend that they retest that animal when they bring it into the facility, and then test it again 4 to 8 weeks later. If they get 2 negative tests, then they can rest assured that that animal is safe to be moved into the general population. We would also recommend that you test all breeding animals at least once a year, and this can be done when the animals are vaccinated, or when they're getting their teeth cleaned, or when they're having their annual heartworm testing done. But this way we can assure that that kennel is maintaining a negative status for canine brucellosis and not getting exposure. Ideally, all breeding dogs would not leave a facility except to receive veterinary treatment, but we know that this is probably not the case. A lot of kennels are still using live cover for their breedings, and so those dogs are being exposed to animals outside of their own facility. What we would recommend is that when those animals return to the kennels, they be quarantined for a minimum of 30 days and test negative prior to being put back into the main kennel population. This is important for people to think about because they may borrow out a male for a breeding situation and then have plans to bring it immediately back into their facility and breed a female who's come into heat. And they need to factor in the quarantine time when they're loaning out their animals or when they're facing potential exposures outside of their kennel to make sure that they're protecting their own kennel. In general, accurate and timely testing can be a real challenge with this disease. Unfortunately, there's no single test that can positively identify each and every case in every kennel. Brucellosis canis can be difficult to detect because of the nature of its cell wall. Brucellosis canis has a rough-coated cell wall, which makes it different from all of the other members of the genus, which have a smooth coat. And unfortunately, this makes testing much more difficult, and we don't have an established pathway to say this is the first test that you should run and this is the confirmatory test that you should run. For all of our other brucellosis species and other animals, we have a very established pathway. We can say that you need to start with this test, and if it's non-negative, you should move on to this test. And unfortunately, we don't have that for canine brucellosis. The rough cell wall morphology causes cross-reactions with several common pathogens that we see in the respiratory system, such as Pseudomonas aeruginosa, Staphylococcus, Bordetella bronchioseptica, and Actinobacillus equili. And what happens with these cross reactions is that we can see a false positive result on our standard serologic screening test. The good news is that we can add a reagent called 2-mercaptoethanol to the testing, which can help with the interpretation of these test results and eliminate false positives due to a cross reaction with our respiratory pathogens. If you submit an RSAT, or a slide agglutination test, or a tube agglutination test to your laboratory, and those tests turn up positive, it is not uncommon for them to go ahead and add the 2-mercaptoethanol reagent to that test and run what we would call a MERSAT or an METAT test. If there is only a cross reaction causing that initial positive, those tests will come back negative. So it would not be uncommon for you to get test results back where the RSAT test is positive, but the MERSAT test is negative. It is most likely that that dog is truly negative. It just had a cross reaction on the initial screening test, and you can go forth with a negative test result. Other challenges that we face with our testing is that it may take 30 days to 3 months post-infection for a lot of our standard tests to be able to detect an infection. Unfortunately, a lot of owners don't know the exact moment that the infection occurred in each individual dog. They may be able to tell you when they brought a new addition into the kennel, but they may not necessarily be able to tell you when it spread from dog to dog within their kennel. So this can be challenging when you're trying to choose a test based off of how soon it can detect infection. The other problem is that there's no true gold standard test for canine brucellosis. In a lot of other diseases, we have a gold standard. So for tuberculosis in cattle, for example, we know that if a veterinarian goes out and does a caudal fold test and it ends up with a suspect, they will call us in and we'll do a comparative cervical test. If that animal tests suspect on that test, we will go ahead and we'll collect tissues to be sent in for culture. If the culture comes back positive, we know that that animal has bovine tuberculosis. If the culture comes back negative, we know with certainty that that animal didn't have bovine tuberculosis, and that herd will return to a negative status. Unfortunately, we don't have that benefit with canine brucellosis. The gold standard for canine brucellosis is indeed the culture, but there are caveats with this test that make it hard to interpret. This test can take a long time to grow in the laboratory, upwards of 60 days, and the bacteria may not grow at all, giving us a false negative. So what we can interpret from that is that we have a negative on that test simply because the bacteria didn't grow that day, but that doesn't mean that the animal is truly negative. So only a positive test on bacterial culture has value for canine brucellosis. A negative test doesn't mean that that animal is truly negative. The value of this test can be increased by performing serial cultures. So what we do is we perform a minimum of 3 tests collected at least 24 hours apart using either a blood sample or a vaginal or seminal culture. And if that animal tests negative on all 3 of those serial tests, then we can feel more confident with our interpretation that that animal is truly negative. We typically will divide our testing up into screening tests, which are quick to receive test results and usually less expensive for the owner, and confirmatory tests, which may be more expensive and may take a longer time to get those test results back from the laboratory. Our standard screening tests are the card test, which can be run in-house in your hospital, the slide test or the tube test, the cell wall antigen AGID, which does have a problem with cross reactions from our typical respiratory pathogens, the AGID or the PCR or the IFA test. Our standard confirmatory tests are the internal cytoplasmic protein antigen AGID, which rules out the cross reaction by testing for intracellular protein specific to canine brucellosis, but this test is run only at Cornell or the Florida lab. We also have the IFA, the culture, or the PCR test. At the Board of Animal Health, we've compiled a summary of all of the canine brucellosis tests, and this is available for you on our website, or you can contact our agency and we'd be happy to send you a copy of this. What we've developed is by looking at several different resources, including Green's Infectious Disease of the Dog and Cat and a publication from the Center for Food Safety and Public Health out of Iowa, we have taken information that they provide on all of the various different tests and put it together in one double-sided chart for you. So the front side of the chart contains the screening tests and the back side contains the confirmatory tests. So what this chart includes is the name of the test, the sample that you might submit, the earliest detection for this test to be able to diagnose infection, and that's in weeks post-infection, advantages of the test, disadvantages of the test, and any notes that we felt like might be important. So if this is something that you'd like to have access to, please don't hesitate to get on our website and download a copy or contact our agency and we'd be happy to send you a copy of this chart. I'd like to wrap up testing by encouraging you to go back to what we learned in school and look at the entire clinical picture when you're interpreting these test results. Don't go simply by what the test result is that's printed on the paper that you receive. These tests can be challenging and we have to consider the history of the animal. Has it had appropriate breeding exposures? Has it had previous reproductive successes or failures? Or has the dog recently been treated with antibiotics that may be causing a false negative test? Be aware of the test that you're using and the strengths and weaknesses associated with this test, and this is where our chart can come into play and be of a benefit to you, I hope. And lastly, look at the risk of that animal to its population if the disease goes undetected. So for example, we would evaluate the test results on a breeding animal from a commercial kennel much more critically than we would evaluate the test results from a pet animal or a service animal. There are some veterinarians that if they get a positive on a card test or a standard agglutination test on a breeding animal, that animal will be removed from the breeding population based on that test alone. And obviously with a pet animal, we wouldn't make that same decision. We would go ahead and do confirmatory testing before making any decisions about the fate of that animal. This is an example of a chart that we made as we followed a kennel through their work towards elimination, and this was done a couple of years ago. You can see that this kennel started out in June of that year with 4 positive test results, and those animals were exhibiting clinical signs, so we felt fairly confident that those animals did indeed have infection. Over the next 11 months, this kennel worked towards elimination. So they started with approximately 40 adult dogs, and over the course of the next 11 months, they conducted at least 125 tests working towards their elimination or eradication. They ended up euthanizing approximately 50% of their adult dogs, so you can imagine this was very, very costly and very emotionally devastating for this kennel to work towards elimination. Treatment of these dogs is absolutely not recommended, as these dogs are considered to be infected for life. Generally, we recommend euthanasia of infected dogs. Remember, do not sell these dogs, don't adopt them out, and don't rehome them. We get questioned a lot about spaying and neutering, and I have to say that this is a risky option, especially in a breeding facility. Female dogs can shed bacteria for up to 2 years after their surgery. Male dogs can shed the disease in their urine for years, even with aggressive antibiotic treatment. So we generally recommend this only for dogs with specialized training, such as police dogs or service dogs. And now we're starting to end up with this treatment for pet dogs where the owners absolutely won't consider humane euthanasia of those animals. As I mentioned previously, this is a zoonotic disease, so transmission to human usually occurs when infected fluids or tissues come in contact with broken skin or mucous membranes. Ingestion of the infected fluids or tissues can also result in a zoonotic infection. Symptoms in humans are typically flu-like symptoms with a waxing and waning fever, lethargy, or headache, but it's important to remember that affected humans may be completely asymptomatic. Testing in humans can be just as frustrating as it is in dogs and may be difficult to detect serologically. A lot of medical providers will recommend active post-exposure surveillance where the affected humans will monitor their body temperature 1 to 2 times a day and notify their medical care providers if they notice a trend or chronic fever. The best way to prevent the disease is to wear gloves when assisting with whelping or abortions, and this applies both to kennel owners, breeders, and veterinary professionals. And remember to wear PPE or personal protective equipment when cleaning infected kennels or post-abortion. And this is very important for us as veterinary professionals to remind our owners. When they are cleaning after they've been diagnosed as a positive kennel or post-abortion, we need to make sure that they are wearing PPE when they're cleaning. Sometimes they will come in with pressure washing equipment and aggressively clean their kennels, and it's possible to aerosolize that bacteria, and if it comes in contact with their mouth or their mucous membranes, they can be affected. So we need to make sure that we're reminding them to wear PPE when they're assisting with whelping or abortions and when they're cleaning infected kennels or post-abortion. We've been asked in the past if it's possible to rehome these animals when they present to the veterinary hospital for euthanasia. And while we can't tell you that you aren't allowed to do this, we certainly would never recommend that you consider rehoming these animals. I urge you to consider the liability risks to your veterinary practice and to you as a veterinarian or a veterinary technician if you adopt out a known positive animal with a lifelong infection of a zoonotic illness. This is a liability that I would not be willing to assume, and I'd urge you to consider prior to rehoming these animals. These dogs are considered infected for life, and even dogs that are surgically neutered and treated with aggressive multimodal antibiotic therapy, they can still shed bacteria into their environment, which could result in other dogs in the home being affected or a zoonotic infection to their owners. Cleaning and disinfection, we've got good news in this front. Brucellosis canis is short-lived outside of the body, and it's readily inactivated by common disinfectants and sunlight. So bleach, Lysol, Rocal, or Parvasol are all effective in eliminating this infection if they have the appropriate contact time for disinfection. The bad news is that B. canis is stable in the environment, inorganic debris, for up to 2 months, so it can withstand drying and freezing, and it can survive in water, dust, and soil. So it's very important for us as veterinary professionals to make sure that our breeders are removing all of the bedding and shavings and all of the urine and feces from these kennels and from their environment prior to cleaning and prior to disinfection. The other thing that we need to make sure that we're stressing is that contact time is important, and the owner should follow the labeled directions on how much time these disinfectants need to contact the surfaces in order to maintain appropriate disinfection. This could be 5 minutes or it could be 10 minutes, but they need to clean the equipment or the facilities, apply the disinfectant and allow it to stand for the appropriate amount of contact time, and then go back and rinse off those surfaces so that they avoid corrosion of their facilities. So when faced with a suspected case, what should you do? And these are situations where the owner presents an animal to you, maybe because they are unable to get them bred back, or they've suddenly had an abortion and they've never experienced that in the past, and canine brucellosis is now on your differential list. We'd ask that you have that owner isolate or quarantine that suspect dog when it returns to the facility and test the affected dog. Remember that since January of 2015, canine brucellosis is reportable in the state of Indiana, so all positive results must be reported to the Board of Animal Health, whether those test results are done in-house or at a laboratory. And it's the responsibility of the owner, the veterinarian, and the laboratory to report these tests to our agency. We would rather have multiple reportings on a single case rather than no one report a single case. We'd also recommend that you stop movement into and out of the kennel of both people and dogs until a test result is returned to you. So once a test result is positive, what will BOAH do? We will consult with the submitting veterinarian to determine what the reason was for testing, whether this is just a standard screening on these animals or whether there were clinical signs or a reproductive history that suggests that canine brucellosis should be considered. And then we'll meet with the owner to perform an epidemiologic investigation, hoping to look for the source of infection and provide information on the elimination and prevention of disease in that kennel. We will not step in and tell you or the owner what tests need to be performed. We won't pull blood samples. The owner will still be required to work with you as their veterinarian to perform this testing to achieve elimination. So what do you do as the veterinarian of this positive kennel? We'd encourage you to work with the owner to develop a plan to achieve elimination in this facility, and that would involve removing and euthanizing all positive dogs. Remember, don't sell or lease these dogs. Don't rehome these dogs. We'd want you to advise the owner that serial testing will be necessary every 30 to 60 days until 2 negative whole kennel tests are achieved, and that's considered elimination or eradication of the disease. Remember to remind these owners that this is going to take a long time and it can be very costly, and they need to be prepared for that in advance. We'd also ask you to remember that everything in the kennel must be cleaned and disinfected as they work through this process. I want to touch briefly on quarantine facilities because, as I've mentioned earlier, this is of utmost importance in the prevention of this disease and getting owners towards elimination of the disease if they're infected. A quarantine facility is used for the temporary housing and observation of recently purchased dogs or animals that are returning to a kennel. And this is very important. A quarantine facility needs to be a separate room or location within that facility, and this can be a stall in the barn, this could be a bathroom that's away from the other dogs, this could be a separate room in a commercial breeding facility. What we don't want this to be is a kennel at the end of their main kennel facility where the dog is just kind of kept away from all of the other dogs. These dogs really need to be quarantined in a facility or in a room away from all of the other dogs in the facility. Ideally, this facility would allow for animals to be moved in and out without exposing other dogs. We would recommend that the owners limit access to these areas to essential personnel only. We'd recommend that they use surfaces which are easy to clean and disinfect, so obviously wooden countertops would not be great in this facility area. We would advise owners to clean and care for animals in this area last. After they've completed their chores and cared for all of the other dogs in the facility, they come to this room last. And they should always wear personal protective equipment when working in this area so they don't potentially spread disease out of this area and they can keep it contained. The Board of Animal Health has developed a guidance document for canine brucellosis, and in this document we talk extensively about quarantine and isolation facilities and what breeders can do to keep this disease from getting into their facilities. If you'd like a copy of this brucellosis guidance document, it's available on our website, or you can contact our office and we'd be happy to send you a copy of this document that can be reproduced and provided to your breeders. I'll wrap things up today with some final thoughts and take-home messages. The absolute best treatment for canine brucellosis is prevention. If you take nothing else away from this presentation today, it's to remember quarantine, quarantine, quarantine. We recommend that you quarantine all additions to the kennel, both new additions and animals that are returning to the kennel after a possible exposure. Remember that only purchase dogs from known reputable sources. If a purchase seems too good to be true, it probably is. Remember, there's no such thing as a free dog. We'd ask you to remember to discuss quarantine procedures and biosecurity with every breeder every time that you're talking about prevention of canine brucellosis. And finally, when you're interpreting test results, always consider the clinical signs of the animal and the reproductive history of that animal. That concludes our presentation today. For more information, you can click on this link to download a copy of our Canine Brucellosis Guidance document. You can also feel free to contact me directly. My email address is mjustice@boah.in.gov, or my direct phone number is 317-439-4888. This last slide contains a link to the quiz Veterinarians and registered veterinary technicians can earn 1 hour of continuing education credit for completing this quiz online and submitting it to our agency. Thank you for joining us today as we talk about canine brucellosis. I hope that you've learned things that can help you in your day-to-day practice.